Let's go back to our leading story then, where the Health Minister, Dr. Zweli Mkhize, has launched the COVID-19 electronic vaccination data system for people who are aged 60 and above. Those who are eligible to receive the vaccine include essential workers, persons in congregate settings, those over 18 with comorbidities. The launch forms part of the Health Department's preparations for the second phase of the vaccination rollout program. It will run from the 17th of next month. Let's get more information. We're now joined via Zoom by Milani Wolmarans, Project Manager for EVDS. A very good afternoon to you, ma'am. Thanks so much for joining us here on SABC News.
Good afternoon, and good afternoon to the viewers, and thank you for the opportunity to give some insights into the program.
You're most welcome, Milani. Just as a start, take us through the technicalities of really how this program is set to work.
So the launch this morning was the official launch of the South African registration portal for the COVID vaccine. It is currently a web-based portal on the internet. You would go onto the internet, you would type in vaccine.enroll.health.gov.za, and it will take you to a landing page where you will receive information, and then you just follow through the steps. There's 7 steps, providing us with very basic information that will allow us to communicate with you during the vaccination program, but it also then provide us with information to be able to plan for the vaccination program, and also give us information to, once the vaccinations start, then to communicate with you via an SMS in terms of the date, the time, and the place where you will receive your vaccine.
All right, so my first reaction obviously was, the fact that I'm concerned that it's not pro-poor, nor is it pro-elderly. And ironically, this is who it should technically be targeting. The fact that it is web-based, the fact that it is internet-based, as you say, might pose a challenge for some in our society, in our country. I mean, some people don't even have, let's just say, smartphones or, computers with Wi-Fi, internet, all of that. And I just wonder what the plan is there. I mean, is there a contingency plan for those who won't be able to access it? As it sounds like something very important, and if we can access it, it's great. But what happens to those who can't?
Okay, so thank you for the question. There are different options and contingency plans that are being put in place. There is the option that we are allowing for, which is called assisted registration. There's 2 components to it. The one is all the provinces has committed to implement programs to allow different communities to register, where they will put up kiosks where people can go to. Some will put it up in clinics, some will put it up in community libraries. We will also use, as the Minister has indicated, our community health workers to go to places where they are in our rural areas, so that we can allow as many as possible individuals to register. There's also the option that if you haven't registered during this process of the portal, that you could register at the vaccination site once it's operational. Yeah. And we are exploring options on how we can make it functional, so that it's possible to also register on an analog phone and allow more people to access the registration.
The thing is, with all the technology that can be introduced, we still find situations where people still sort of queue up, and in a pandemic that's really quite dangerous. Still sort of queue for things. I mean, if you look at things like accessing grants, people's SASSA cards, people are still queuing up. I think when something like this is being introduced, perhaps then there also needs to be some kind of education at the back of that in terms of ways around it. So it's not about just creating alternatives or different options, but also perhaps doing the footwork in terms of the pre-launch of these things. And I wonder if that was sufficiently done to make sure, because as I say, my concern is really around those that are impoverished in our communities. I mean, some of the people that are elderly don't even have phones. That's the reality of the situation. So even if you can say, different kinds of phones, you'll find some that don't even have a phone. So I really want to understand in terms of how that will then be addressed. Although I'm worried that it might be late, as this product has already been, launched.
So, yes, you're correct. So, like I've indicated, there is programs, and in that is where we will use our community health workers to assist those that doesn't have the technology to be able to do the registration. And if I could just go on to a point that you have just raised around people queuing and queuing for a service.
Yeah.
One of the reasons why we have got this registration system is exactly to plan the vaccination program so that we allow people to come in certain time batches, as we call it, to our time slots, and that we don't have a situation, and as much as possible try and manage the situation where we don't have overcrowding and stampeding, if we can call it that, at the vaccination sites. It's a program that has never been implemented in the country, and the system is adjustable, and we will adjust as we move forward and accommodate inputs from different stakeholders so that we can make it more accessible as we move forward.
All right, and then just in closing, as we wrap up our conversation, Milani, let's just say you do, my understanding, and perhaps you can clarify if I don't understand, let's say you do get given a date as to when you can go for this vaccination after you have registered and gone through the process, but for some reason or other you're not able to go on that date, or there's some problems or whatever it is. What are the options then? Do you re-register? What happens afterwards?
At the vaccination site, because we will have your information, it will be possible that we will give you another date that you can come for your vaccine. So nobody that registers that they want the vaccine will be denied a vaccine. And we will make sure that everybody that registers get the vaccine at the closest place to where they either live or where they work, so that we ensure that we can vaccinate as many as possible of the population above 18 years.
All right, yeah. Thank you so very much, Milani. We appreciate your time, ma'am. Thanks for speaking to us here on SABC News.
Thank you very much for the opportunity.
You're most welcome. That's Milani Wolmarans, Project Manager for EVDS, of course, the electronic vaccination data system that has been launched by the Health Minister, Dr. Zweli Mkhize, where those who are eligible to receive the vaccine are able to go there online. We've put up the website for you, where you can go indeed to register, just there on the screen. Please do take that information down and do get it to, if you do have elderly relatives as well. If you can help them, please do.